Okay, my name is Mitchell Bunn. We're going to do the valgus stress test at the elbow, checking the MCL. So we're going to stabilize the humerus. We're going to apply a force from the lateral side, checking for laxity there. We're also going to do the slightly flexed position, and we're going to do it bilaterally. Laxity would indicate an MCL sprain.
My name is Kim Richards. We're doing the various stress tests on the elbow. We'll apply a various force to the elbow in both the extended and flexed positions to check for laxity. That would be indicative of an LCL sprain.
All right, I'm redoing this as the passive lateral epicondylopathy test. And to do this, we're going to stretch the wrist extensors. So we're going to flex the wrist here, since it's passive motion. And for this, a positive test would be any pain that would indicate any epicondylopathy or tendinopathy.
All right, I'm Shane Yoho. I'm doing the active lateral epicondylopathy test. For this, you would take the patient and have them press against your hand. For this, you're checking for pain on the lateral epicondyle. A positive test would indicate lateral epicondylopathy or tendinopathy.
All right, now we're doing the passive medial epicondylopathy test. So we're testing the wrist flexors. We're going to have them in this position, and we're going to stretch them passively. So I'm doing it, I'm pushing it, and that's testing the wrist flexors. Any pain would indicate the medial epicondylopathy or tendinopathy.
All right, now we're doing the active medial epicondylopathy test. So what we'll do is we'll have the patient resist motion by flexing their wrist flexors. And if there's any pain over the medial epicondyle, it could be indicative of medial epicondylopathy or tendinopathy.
All right, next we have the elbow flexion test. So for this, we'll have the patient flex their elbows and extend the wrists out. And we'll stay in this position for 3 minutes. Positive test for this would be any paresthesia. And for this, we're also looking, positive test would indicate ulnar nerve entrapment or compression.
Okay, now we're doing the radial ulnar collateral stress test. For this, you would stabilize here and put a stress on the ulnar ligament here. Then for the radial ligament, you would stabilize and put a stress on there. For this, you're looking for either pain or laxity in either of the ligaments, and that would a positive test would indicate an RCL or UCL sprain.
Now we're doing Fallon's test. So what we're going to do is we're going to have the patient bring their hands up into this position, and they're going to just go into maximum flexion for 1 minute. A positive test would be any paresthesia, so the numbness or tingling feelings, and that would indicate carpal tunnel syndrome.
All right, now we're doing the Finkelstein test. So we'll have the patient put their thumb in that position and wrap their fingers around, making a fist. Then they'll ulnar deviate by pointing down. And if there's any reproduction of symptoms there, then it could be indicative of de Quervain syndrome.
Next, we have the various valgus stress tests for the fingers. So for this, we can come to the joints here in the fingers and apply any valgus or various stress tests, any valgus or various forces. And we're looking for laxity, and that would show for any collateral ligament sprains.
All right, this is the trigger finger test. For this, you would have the patient bend one finger at a time. You're looking for a painful nodule or the finger to lock. A positive test would be flexotenosynovitis.